I'm Mariel Jessup, Chief Science and Medical Officer of the American Heart Association, with a message to the AHA research community. We know most of you are experiencing significant challenges conducting research at your institutions during this pandemic. You no doubt have questions about steps the AHA is taking to support your research programs. I can hopefully answer many of the questions you have. But first and foremost is the safety of you and your research team. We trust you are following the direction of your sponsoring institutions regarding access to laboratories and research clinics. We are aware of the varying responses to the pandemic, ranging from all research activities being suspended indefinitely, to reduced operations, to remote working until further notice. We understand the need for many decisions to be made at the level of your institution, and we are fully supportive of that. The AHA has adopted flexible grants management policies in recent years, and we're going to expand the flexibility as much as possible during this crisis. I will address some broad topics here and note that what I'm covering is also on our website, professional.heart.org/research. Let me address first disruptions to ongoing research projects. If your funded project is placed on hold indefinitely, please let AHA know. AHA will support carryover requests related to suspension of research projects, and we will also allow any budgeting you might need to do to best manage your research. Let me also touch on required reporting to AHA. The next major deadline for scientific progress reports is in June. For those of you funded through our strategically funded research networks, you may also have subject recruitment and retention reports due at that time. As of now, AHA is not extending these upcoming deadlines. However, if your situation becomes such that timely submissions is not feasible, please send an email to awards@heart.org and we will work with you on an alternative deadline. Likewise, if submission of an upcoming expenditure report is likely to be impacted by closure or reduced staffing of your institutional accounting office, please notify AHA by sending an email to awards@heart.org and we will work with you on extending the deadline. My third point regards award extensions and salary expenditures during work stoppage. Because these conditions may persist for some months, extension of your award period may be of significant help to you. No-cost extensions are available as always. If your award is currently on a no-cost extension, you may qualify for an additional extension. AHA also realizes you and your staff may still need to draw salary during these times, even if your ability to work is minimal. AHA will allow payment of salary support on grants and fellowships for up to 60 days without pre-approval during periods of work stoppage. Should inability to conduct research exceed 60 days, please contact the AHA. What about expenses incurred related to canceled travel? If you have incurred non-refundable expenses, for example, conference registration fees or purchased airline tickets for a scientific conference that was canceled, you can still charge these expenses to your AHA grant. And finally, the new deadlines for new application. We know you have a lot on your plate now and might not be thinking much about upcoming grant opportunities. We certainly understand that. I will note, however, that AHA's next round of funding opportunities is not until August. As of now, we have not changed these deadlines. We will keep close eye on conditions at your institutions, and if we do decide to delay deadlines, our plan is to make those changes at least 6 weeks prior to the originally scheduled deadline. Let me reiterate that all updates and announcements can be found on our website, professional.hart.org/research, and this will be updated as things change. That's all I have for now. I wish you good health, safety, and hope during this time of unprecedented challenges.